So it basically runs on an infrared spectrum. Thanks, mate. So what it does is it shoots a laser through here, right? And it creates like a light that passes through whatever you're testing, in this case a tablet or a powder or a liquid. And inside here is a library. So in the UK where these are set up, they test all of that equipment. Oh, sorry, they test those medicines and then they put a library of what that light spectrum should look like, if you like. And then when you test something, it compares it to the library. Yeah? So same as, this is authentic, does it look the same? No. And then if it looks the same, it says, yes, this is genuine. So, and if it doesn't, the spectrum doesn't look the same, then it fails it. And it won't tell me what it is, it just tells me that and I'll show you as I go through it, it's not what I'm testing for. And then if it passes, then normally we go, okay, that's genuine medicine and it might be illegally diverted. If it fails, then we'll send it off to the UK for proper analysis. Yeah. So this, we call it it's just our name for it, we call it the Ahura field mouse, because we think it's good for sniffing out counterfeit medicine. My boss thought that. Anyway, so you can see it's pretty simple to use. The actual course for this was 3 days. So 2 of which was like occupational health and safety. Don't point lasers at people's eyes, okay? There you go. All right, so you can see here it's got a number of things. So I've already logged in with my pass. Right, and this is basically, it says run. So if we push here, you can see now this brings up the library of all the medicines that are, right, so they're all the things that I can test for. The medicines that have been entered into the actual library and we can compare. So we scroll down, you can see there's quite a few of our medicines in there. The ones that we enter in here are normally the ones that we've come across most commonly out in the field. Right? It's not our whole medicine of a library of medicines that we make. In this case, what we normally do to see whether the thing's working properly or not is we clip that on the front, and this is just a little cylinder of polystyrene. Okay, so plastic basically. So we put that in the front, we select polystyrene, yeah, we hit yep, that's what we want to test for. In this case we'll put in P for polystyrene 1, and then we just hit done. Okay, so you can see here it comes up with, okay, I've entered in that I'm going to test for polystyrene. I've entered in a marker in P1. Right? So normally when I test medicines in the field, this is like the first, it's like running a science thing, so this is like the control. Okay, so if it tests and this works, then the machine should be working properly, right? Or the device should be working properly. So we enter in P1, which normally signifies this is the start of a testing run. And then all we do is hit go. And you'll see the lights come on up the front here. So that's now shooting a laser down into the polystyrene. And it's creating that light source back. Okay. The machine will then test that, compare it to the library and go, yep, that's polystyrene. Okay, so you get a pass come up. Okay. So that's the start of it. And all that looks pretty simple, but some of these things can take quite a few minutes when it starts doing stuff. Right. So for medicines, we just attach a different, or tablets, we just attach a different bit to the front. And now you've got a little tablet holder. You can put a tablet in there. Are these counterfeit or illegally diverted, Jack?
Legally diverted.
So they should be genuine?
One packet of Crestor there that's real.
So this should come up as a pass, is that what you're telling me?
Yeah.
I did that before once and it failed it. Okay, so you just put the tablet in here, okay, and you can see that it's at the bottom there. Actually, change that around. Try and get the testing area as nice and smooth as possible, not with a big line in it. We'll test that side. So that's where the laser hits it on the bottom. Yeah. So slide that in there. So this time we go run. We're testing Crestor. 10 milligram. So we go back up in the library to Crestor, and you can see here this will test 2.5, 5, 10 and 30, right? So the light spectrum for each of those will be the same basically, or it will compare them against those, right, just by testing here. Right, so we say yes, that's what we're testing. So I normally put in, this is my first test, so DH, which is Danny Otter, and number 1. So all the tests are stored internally, so I can download this onto a network and it'll produce like reports and all that sort of stuff as well, which we can supply. So P1 shows start of a testing sequence, DH1 then goes onto a testing sheet, and I'll write DH1 is Crestor 10 milligram, sourced from Azrak Pharmacy in Malaysia. Yeah, had Indian packaging, etc., etc. Right, so it's done. So we hit done. We're going to test Crestor 10 milligram. You can see the lasers are working. See whether Jack's right. Where was this source from, Jack?
Sri Lanka. Is
Sri Lanka?
Turkish packaging?
Yep.
Sri Lanka.
All right. So this would go down as testing, you know, Barbara Mullen testing product from Sri Lanka, test buys, okay, and then we'd fill in a whole sheet. So what we're looking for here, if this comes back and it passes it, we say yes, this is genuine AstraZeneca medicine, but this should not be in, right? And if it failed, then we would get that shipped as quick as we can to the UK and get it analysed to see, you know, what's in it. And then that would then be a real priority, because now you've got counterfeit Crestor in the marketplace. Yeah. And hopefully the UK can tell you pretty quickly, you know, if there's anything dangerous in that that's going to really impact on patients or not. And then we report that through to MOH or FDA in each country and say, this is, we found this in this market. And, yeah, so hopefully they get the message out, and also the business can also send messages out into the marketplace.
When they analyse it in the UK,
Yep.
are they able to, they just pull apart all the active ingredients?
Yeah. Well, what they do is they will compare it to a reference. So they will look at what it should be. So they will do another one of these,